I want to respond directly to some of your comments and why some of your statements are not correct. First, let's understand what shared clinical decision making is. It's when there is a recommendation that cannot necessarily apply to everyone for many reasons, and the doctor and the patient have an individual discussion on risk versus benefits, which is different from informed consent, which is what doctors do every single day with their patient for every single vaccine, medication, treatment, intervention. The decisions from the vaccine committee are supposed to be recommendations on how vaccines should be used. By definition, once the recommendation is made, doctors use informed consent to discuss it with their patient. So the fact that the committee took away the vaccines and made everything shared clinical decision-making makes no sense. If I recommend, for example, to a patient that they need a colonoscopy, they can refuse the colonoscopy, but we've had that informed consent discussion. And if they choose to refuse it, that's their choice. But the recommendation doesn't change. They still need the colonoscopy. The same thing with the vaccines. The data and evidence was clear that they needed to have these vaccines. The committee just decided to remove them arbitrarily. When we look at MMRV that they removed, this decreases access for patients to get the combination vaccine, and it makes it more difficult for patients to get vaccinated. On the birth dose of hepatitis B, there was no reason to change this. Just because some people felt they didn't have enough of a discussion doesn't mean you change the recommendation. The data clearly showed that the recommendation for everyone to get a hepatitis birth dose B vaccine was still good. In fact, one of the authors of the study was actually a liaison, and they misquoted her and ignored her when she corrected them. You don't change the recommendations because you don't like the outcome or because you feel that your doctor didn't have the discussion. The recommendations stand. If the process isn't working and patients felt they didn't get enough of a discussion, then that process needs to be addressed. You don't destroy the vaccine schedule based on ideology. So the bottom line is this. If you were truly watching the committee for the past almost 10 years, you would have seen that this committee has not been using an evidence to recommend framework. They have not been appropriately, adequately looking at the data and evidence. They have been cherry picking it. They have been pushing an anti-vaccine ideology, and they have not been addressing the issues. We need a functioning advisory committee. I've been involved for almost a decade, and you can understand my experience if you had been watching all of those meetings for the past 10 years.